GPT, you can use it in 3 formats. So either as a, you can go to the website and do it, or there are desktop formats which are available, or in a browser also available, or there is an app which is there. So every AI has got this sort of formats, 3 formats that you can use. Now what is important is when these large language models are giving it as an output, we have to give something called as prompt. So let us go to a restaurant. Now you order a rava dosa, nalla kallula nalla போட்டு நல்ல மொறுன்னுட்டு கொஞ்சமா வெங்காயம் போட்டு பொடி போட்டு அதில் கொஞ்சோண்டு நெய் ஊற்றி லைட்டாக ஒரு முந்திரி போட்டு நல்லா முருகலா எனக்கு சூடாக வரணும் அப்படின்னு எப்படி சொல்கிறீங்களோ அது மாதிரி you have to give something called as prompt. Unless you give a prompt, then you are giving in the you are going to the restaurant, that is called as an interface. The kitchen is the large language model and the output is the dosa. If you want the dosa to come out as you need to know how good you are doing prompt. So prompt is called prompt engineering. They gave various names to all these things, but fundamentally we need to understand the very good the format is, the very good the output would be. If you all want to learn a single skill today, it should be what is called as this prompt engineering is the most important. The format for a good prompt would be, who am I? So what am I doing? And we should ask what role the generative AI or what role the language model should take. So I am a doctor. You are going to give an output for a doctor. So you should define it very clearly. What is the task? What is the task that we are asking the machine to do? How do you want the output? Say like you want it as a PDF, you want it as an image, you want it as a video, or you want it to explain to a 6-year-old kid. You have to explain this to the machine in the form of a prompt. Say for example, 3 things are very important. You should know what is the role, what is the task, what is the format. So your prompt should match all these 3 things. So when we say, I am a physician, I want the summary for the physician. You have defined the role. Your role, what machine the machine has to take. I want you to read and interpret the article. You may be attaching it as a PDF. It has to read and interpret it. That is what the task that are you asking the machine to do. And what do you want to do? Give it in the form of a format. So format could be like it could be a plain text summary, or you may ask to give it as an image or a video, or so and so. So that is the format. So your prompt should involve these 3 fundamental elements. What is its role? What task you need to give? And what format you want the output would be. There are so much of apps that we have, but what we need to know is you have to individualize the apps. So that is very, very important. So what I mean to say is these large language models, they are designed to give the output only for the desired task. You can't go and sit in an Indian restaurant and ask for a Chinese food. So this large language model should have the kitchen to equip ourselves. So to give the desired output, that can be possible only when you go to the particular restaurant. So you should land up with a particular app. See, if you see this ECG, just see this ECG and find have your findings, your own findings. Now I am trying to ask ChatGPT what will happen for this ECG. The patient came with a history of 2 days of chest pain. Now I will give what ChatGPT gives. So I have given the ECG. The ECG is telling some findings like that's okay. So I am trying to attach this ECG and ask it what is the finding of it. What happens to this patient. So I'm sorry, like technical glitch is not showing clearly, but are there, and I'm telling like, is there an ST elevation which is there in the ECG? Are you able to see? So the ChatGPT then recognizes that yes, there is an ST elevation. See, what do we want when we try to do this sort of prompting and ask this generative AIs? It should be able to tell us very clearly what is happening there. So ChatGPT actually had missed what the changes over there. If you see in the ECG, there are some subtle findings which are not picked by the ChatGPT. So there are some changes in the V1, like there is an ST elevation which the ChatGPT is missing. So what do we need to understand over here is the ChatGPT is not tuned to find out all these things, or it doesn't have the ingredient to pick up all these changes. So you should not ask ChatGPT. Rather, you should ask an AI app which has been fed all these things. So if you want to interpret your retinal image, the app should have fed all these changes, and that should be able to reflect what is happening over there. Now, ChatGPT is not good in picking all these things. So when you give a, say, based on this German model, when they are able to give to this app, so this is called as a, I'll just show this video.